Good morning. My name is Lainey Duran, and I'll be discussing case study number 1, infectious diseases. For this first section, I'm going to be talking about the signs and symptoms listed on the case. We have a 17-year-old high school student that comes in with multiple complaints. The first two symptoms include sore throat and fever, which are usually associated with multiple infectious disease processes. Vital signs were within limits. Blood pressure and respiratory rate were normal. The skin was warm and dry, with no rash present, which is also a normal finding. Now, upon inspection of the tonsils, they were found to be enlarged and overlain with exudates, requiring further inspection. The patient reports tenderness upon palpation of the lymph nodes in the cervical, axillary, and inguinal areas. But the most concerning finding is the presence of an enlarged liver and spleen, which are related to more serious clinical complications. Once the assessment is completed, the attending physician orders a complete blood count, which is routinely done to verify lab values and parameters. The result of the blood count shows an increased number of white blood cells and many atypical lymphocytes. The presence of atypical lymphocytes is what directs the next diagnostic test, the rapid heterophile antibody test, which in this patient's case came back positive. The treatment of choice was very minimal and included analgesics and antipyretics for pain and fever management. Rest was also recommended. This treatment was effective in resolving the patient's symptoms in a period of 2 weeks. Complete strength was not regained up until about 3 months after treatment. Based on the case described before, the diagnostic impression is Epstein-Barr virus infectious mononucleosis. What is Epstein-Barr virus? Epstein-Barr virus, also known as human herpes virus 4, is a member of the herpes virus family. It is one of the most common human viruses. It's found all over the world. Most people get infected with it at some point in their lives. EBV spreads most commonly through bodily fluids, primarily saliva, can cause infectious mononucleosis, also called mono, and other illnesses. We should also include the definition for infectious mononucleosis, also called mono. It is a contagious disease. Epstein-Barr virus is the most common cause of infectious mononucleosis, but other viruses can also cause this disease. It is common among teenagers and young adults, especially college students. The first article that I want to discuss is titled Epstein-Barr virus infectious mononucleosis. I found this article to be very interesting and in tune with the case study because it contains a synopsis of typical symptoms, diagnostic procedure, and treatment expected for patients with this kind of infection. This article, presented by the American Family Physician Journal, points out the importance of assessing for infectious mononucleosis in patients between the ages of 10 and 30 who present with symptoms such as sore throat, tonsillar enlargement, marked adenopathy, particularly of the inguinal and cervical areas, and also atypical lymphocytosis of at least 20%. All of these symptoms are also listed in the case mentioned before of the 17-year-old high school student, which I thought was very interesting. The author describes a particularly important piece of information that is useful for directing the clinician towards a proper diagnosis. He mentions that the presence of a splenomegaly, posterior cervical adenopathy, as well as axillary and inguinal adenopathy are most useful in considering the possibility of infectious mononucleosis. On the other hand, something that can lead to the dismissal of the diagnosis is the absence of cervical adenopathy and fatigue. So that's an important piece of information to consider. I found also very interesting that the article mentions that false negative result of heterophile antibody test, which was also used in the study, are relatively common early in the course of infection. A diagnostic strategy is also recommended in the article for patients with the symptoms mentioned before. This strategy includes a white blood cell count, heterophile antibody test, and a rapid test for streptococcal pharyngitis, which was not done in the case study. The recommended treatment included in the article discussion involves symptomatic treatment, that is, providing adequate hydration, analgesics, antipyretics, and rest. The second article is titled Racial Ethnic Differences in Epstein-Barr Virus Antibody Titers Among U.S. Children and Adolescents. This article was very relevant to the clinical case because it involved the particular age group of the patient. It also provided a different point of view of the Epstein-Barr virus, which is ethnicity and racial background. The authors of the article collected information from the National Health and Nutrition Examination Survey. They included multiple ethnic groups, but ended up analyzing only similarities among Black African American, Mexican American, and white populations between the ages of 6 and 17, and who had tested positive for Epstein-Barr virus. They found that the antibody levels between Mexican American and white youth populations were not that different in comparison to the antibody levels found between members of the Black African American and white populations, which were significantly higher. The interactions between race, ethnicity, and age were non-significant, indicating the associations between race, ethnicity, and Epstein-Barr virus levels did not vary by age. They also included some subcategories in the study. For example, comparison of Epstein-Barr virus antibody levels between males and females, where it was determined that males had lower levels compared to females. Other subcategories showed significant association between Epstein-Barr virus antibody levels and age, socioeconomic position, foreign birth status, household size, smoking status, BMI, or general health. The authors conclude the study mentioning that findings suggest that viral reactivation can lead to two things that I've included here on this slide. That is cellular immunity, and is also more likely to occur among minority youth. I consider this final statement to be very important because it can lead to the development of future treatments tailored for particular ethnic groups. The third and final article is titled Epstein-Barr Virus Genetics, talking about the BAC generation. The article talks about the genetic aspect of the Epstein-Barr virus. The article starts by mentioning how herpes viruses have been used for genetic analysis for an extended period of time. The use of BAC, or bacterial artificial chromosome, is explained. The authors comment on how homologous recombination techniques in eukaryotic cells, combined with herpes virus genomes that were cloned onto the BAC, can help in developing recombinant viruses, which in turn can lead to the development of new vaccines. They continue explaining how mutants derived from herpes viruses on bacterial artificial chromosomes have been used for multiple purposes. Some of them include to understand the functions of all types of genetic elements present on the virus genome, and also to generate mutants with potentially medically relevant properties such as preventative vaccines. To conclude, I would like to say that this was certainly a complex but informative article that touched on how important it is to continue the analysis of genetic material for research and clinical purposes.
Hi, Leonie. This is Nicole. So, in response to your case presentation, I felt like you did a really good job. Something interesting that I learned about mono was that with the mono test, they work by detecting the antibodies to the Epstein-Barr virus. However, this takes at least 2 weeks to become detectable. And it's also possible that the use of ampicillin and amoxicillin may lead to a rash of unknown pathophysiology. As far as education, we have to remind our school age and college age patients to avoid contact sports because of the risk of spleen rupture. In Article 2, I found it very interesting and relatable to the study of epigenetics and just how realizing how our environment and social status play a role in our response to disease. Thanks for sharing.